Hey, Angela. Thank you for coming in and sharing your story. You've been through so much these last few years, and I've been treating you for a little over 2 months. And I remember on your first visit, you mentioning the difficulty you were having in your hand, the numbness in your hand, and the difficulty breathing from that medical error. And you actually said to me, that's not actually what bringing me in today, that
Yeah.
you also were dealing with sciatica. Just wanted you to talk about just some of the things, treatments you've been going through, complications. What brought you in when I first saw you?
Okay. When I first came to Dr. Ed, I was basically crawling in here. I had been through over a year's worth of medical treatments from different places, therapies, injections, aquatic therapy, you name it, I've tried it. It all began with my C-spine, and through the course of the year kind of trickled down into an entire lower body, full spine injury or curvature issue. That gave me a lot of issues. Before I came right in here, though, I was hospitalized, prolonged, for a punctured lung that was caused by a physician's error. So I had issues breathing, I had a chest tube, and I also was experiencing a lot of sciatica, lower back pain, difficulty walking, sitting is basically impossible, but Dr.
Right.
Ed has really helped a lot.
That was an injection they did?
It was
what were the
a
treatment?
trigger point injection to the upper right trapezius muscle, and it was meant, I should say what I do professionally. I'm a professional classical musician. I'm a flutist. I have a doctorate in musical arts. I'm a teacher of music, piano, and flute. So lots of forward posture. My hands are like this several hours a day. If I'm standing, I'm shifting my body weight like this, looking over music stands, or I'm sitting in orchestra rehearsals for a really long time. And not sure if that contributed to the lower body issues, but I...
Yeah, the head being forward, causes the tightness here. And I know sometimes we get so focused on the symptoms of trying to release that tension. And I know you were in the hospital, what was it, 10 days or? 9 days in the hospital.
9 days, yeah.
And then there was even complications at the hospital, which the lung recollapsed, said to me. I think it was from like another error that happened. And so just so much you've been through. So they did inversion on you. What other treatments? They did different physical therapy treatments on the lower back?
Yes,
How
on
did that?
the neck and back they did manual therapy. They had me on an inversion table, is it extension, this way? I don't know all the
Bending back.
vernacular for all of the medical terms. Traction on my neck and lower body on the table that kind of pulls.
Any
and
relief with that, or does it seem to make
I feel
it
like
aggravated, or?
it's hard to tell. I think that it took a while for them to understand exactly what we were dealing with. I think they had really good intentions, but maybe didn't understand that because of the curvature issue, what they were doing on a spine that's kind of backwards isn't going to work the same way. So it may have done more harm than good.
When did they get the MRIs? When were those taken?
Those were taken in September.
So a little bit after the treatments, they finally decided to take the pictures.
September was after the Spine Institute treatment. October is when I started with the 3rd physical therapy office.
Okay.
And I was there until January when I had the lung injury.
All right. Okay. You have to cross your arms. Okay. Roll to your side a little bit. A little bit deep breath in. Head back for me. I got you. Exhale. There we go. I got you. There we go. Breathe in deep for me. Exhale. I got you. There we go. One more time. Exhale. All right, good. Stay right there. I remember the first time I worked on your back, did that adjustment. I think nothing happened. It was about as stiff as could be, and with those MRIs, the injury was sort of finally understood by everybody. Hopefully, that we have a disc injury. That the numbness in the hands comes from the pinched nerve in your lower neck. That the sciatic pain comes from the disc pressure hitting the nerve roots in your lower back, and we have to treat the cause, which when you're sitting playing the flute, or years and years of, you just finished your PhD, right? And congratulations, and getting through all that schooling, a lot of sitting, a lot of reading, a lot of looking down, and even your career, the neck. I was watching a video of you playing Jurassic Park, and how animated you are, but a lot of it is your chin is down when you're playing the flute. So when you hold your chin down, it transfers all the work down to your lower neck. So the lower neck starts to age more quickly. The curve in your neck is lost, and certain parts of your spine start getting inflamed. They're doing more mechanical work. So everybody sort of gets so focused on the older parts, what they look like and how inflamed they are, and some sort of treatment that we can do on those areas. And my dad and I believe in working around those areas, that we really can't help the sprained ankle by continuing to work on it. It's another part of your spine that's really the cause. The neck is designed to work. I know we've gone over this many times. The neck is designed to work at the top first. The atlas, which is the first bone underneath your skull, is supposed to do about 60% of the work of your neck, just one vertebrae, and about 45 degrees of rotation. We have about 80 degrees of rotation each way with our neck, and about 45 degrees each way. So 90 of the total 160 degrees comes from just this top bone. So I say that it's the main engine, that if this vertebrae is very stiff, then it's easy to overwork another area, and trying to restore the functionality of this atlas. There we go. And then I think when you're playing your flute, isn't your head turned left a little bit, right? Is it
Tilts to the right.
tilts to the right, but isn't your head is your left
Twisted a little, maybe.
turned left, but tilt is right?
Mm-hmm.
So it sort of pops this out right here. This is an old scar right here on her left upper side. We're going to work on this a little bit here, trying to just keep loosening this up. What age did you start playing the flute?
I was 11.
11 years old.
Mm-hmm.
And but you played piano like real young, right? Wasn't it? You told me.
Like 4.
Mozart, yeah. That's amazing. You can remind me again. Did your parents play, or how did you?
My dad is a musician.
Mm-hmm.
My mom is a nurse.
Okay.
But my dad is more blues rock.
Okay.
So I'm kind of the black sheep, classically trained weirdo of the family.
So was it his piano, or whose? When you learned on?
There was just a random keyboard in our house.
Oh, wow.
That I just kind of started playing around with.
Wonderful.
And when I was in 2nd grade, I saved my allowance and split the cost for a piano, like a used little upright one, with my parents, and I still have that piano.
Wonderful. It's like my first car. I kept it. yeah, nice. A lot of this is just retraining habits. We haven't had a habit of having our head back, and it's maybe uncomfortable because it's foreign. We're not used to. Before my office, probably nobody really put you into a deep extension. So the reason why those discs get injured is because of that constant pressure on the disc. The forward posture increases interdiscal pressure. So the only way to really get the disc to stop rupturing posteriorly, we have to get the weight off the front part, which we call the anterior part, and then reestablishing this arch in your neck, and stretching the spine, getting this curve to be easy.
We have our music on in the background.
Angela probably has played it and knows exactly. You just said music, but she's like, actually, it's.
Yeah.
I'll put you on the spot.
Oh, Mozart?
Very. Duh, Ed.
My husband, lurking in the background, also a musician.
You're like, Ed, this is a Mozart symphony number.
Yes, we could lead it on. It's quite appropriate for teenagers.
Somebody in the comment, actually, it's.
Yeah, right. Opus.
Right. It was co-written by Mozart and. Okay. I know one time I think it was in the other room, and you were, like I think you were saying you were hearing the music and like playing it with your hand at the same time. You're like, okay.
Oh yeah, something was hurting, like that you were working out, and I was like, I'm just gonna analyze this concerto for a minute. Okay, and go.
So talented
That's
brain
what
that I
really
don't.
smart people do when they're in pain.
Yeah, that's probably how I ended up like this.
Like I played the piano for a couple of years, but not by my own desire. It was my parents, just wanted me to try it, and I just had a memorization brain. I could just memorize all the notes. I would just, I didn't even have. I put the music in front of me, but it was just there for place holding. Like like Ed, you need to turn the page. Oh no, I don't need to. It's actually just all in here. I've memorized every hand position, which I'm sure is not a good way to play music, but I did anyway.
She was like that too. I've heard.
When I was
Like,
little,
we
yeah.
Just memorized everything.
My piano
She
teacher got
continued
mad.
playing, and the music's on the next page.
Right. I think you need to turn the. I think is it the entertainer? Da, 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 is that?
Yeah.
That was the one they.
Da, 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 da,
Da, da, da, da, yeah.
da, da, da.
Right, that one? Is
Yeah,
that the
yeah,
entertainer?
Entertainer.
Who I have no.
Joplin?
Joplin.
Okay, very cool. Okay, I am not going to say any. Okay, so Joplin, the entertainer. Yes, that I had to remember playing that the whole thing. Like, and then anyway, but I just memorized all the. And then what is it?
Beethoven.
Beethoven. Okay,
Mhm.
that one I had played too. Okay, easy stuff, Ed. That's like
No.
it's like ABCs, Ed.
No.
I was like 8 years old. Okay. Real gentle. Gonna go really easy. I got you. It's okay. It's okay. There we go. Good. Just trying to loosen that atlas a little bit. There we go. Real gentle. It's okay. Okay. There you go. Very good. Yay. Now, I know some of the YouTube people go, that was a tiny lip. Believe me, there was no movement when we started. That area, and I think it took a few weeks before she'd even let me touch her neck. And no, you're gonna just work somewhere else. And it's tough. There's a lot of, Ed, do you understand how injured my lower neck is, and how uncomfortable it is to work on my neck? And can you do it without hurting my injured area? There's a it's like dancing with somebody. I danced with somebody and they stepped on my feet really hard and it really hurt, and I'm scared you're gonna step on my feet, and so it's just there's a lot of trust, and there is no benefit to moving the aggravated vertebrae, the injured discs in your lower neck. There is a lot of benefit in adjusting and loosening the main engine. So I think one of the first conversations we had, it was like, why do we have to do it? Why can't we just rub it? And I'm going, well, if we don't adjust your atlas, it's going to take much longer than I'm willing to wait to get that area working properly. The adjustment is, I think of it maybe like a hammer. Can you massage a nail into a piece of wood? Maybe it would just take forever. And if you just did adjustments, it would take, not as long. But if you combine adjustments with massage, it's a lot quicker. And then if you do all the gua sha and the stretching, we can get some results much faster. You have to spend time every day stretching this arch back in your neck, sort of reminding your neck that this is home, that your neck doesn't belong straight, it doesn't belong forward. And I know why they did the shots in your lower neck, because the head was forward, there was tightness in your traps, but unless you bring the head back over the shoulders, to me that tightness can't ever be, it won't ever go away. You have to get that head back. And there are injuries and reasons for why your head went forward, and to act like that there's nothing, that we're not going to find anything. No, Ed, I'm feeling stuff when you bring my head back. This is an avoidance posture, what we call antalgia, and by bringing you back, sometimes it can be very, disconcerting. And Ed, it's hurting now in other areas because we're bringing my head back in an effort to take the pressure off the areas that were already injured. How many treatments on inversion had you gone through?
4 months worth.
And how many times a week?
3 days a week.
3 days a week. And then how long were you inverted?
Maybe 20 minutes.
Okay.
On and off. I think they set timers. It's like X amount of minutes, and then they lower it.
So the main thing I think about with inversion, it opens up the holes on the side. So if there's a disc hitting the spinal cord, it doesn't change the spinal canal diameter. it does open up the foramen on the side. So if there's sort of nerve root pressure, it can relieve. It can, we want to say, remove some of the pressure off the disc, which the theory behind it is that because we're taking the pressure off the disc will come back in. The issue with it is that I don't plan on living upside down. I don't plan on. I think of like, was it Back to the Future 2 when the dad, right, when he goes to the future and he's like hanging upside down and he's floating around the kitchen or something. It's like unless you have one of those at home and you plan on living and flying around your house upside down. And then for myself, I'm not sure. My head feels like it's gonna pop. When you're real upside down for a long period of time, your head starts, like your eyes start getting beet red, and then they're like, well, don't go so far upside down. I'm going, well, I'm trying to get traction. I thought the whole purpose is to, open up my lower back. The issue then is that it pulls the spine straight, right? So the lower back should be curved. We call this the lordosis, and that arch in your spine is what allows for weight sharing, like a wheel or an arch. There's an even spread of the work on the spine when it's arched, and so if you pull it straight for 20 minutes for 3 times a week, you're encouraging a straight spine. You're for long term. You're encouraging that straightening, and then I go, well, when you get off the inversion, now again all the weight is continually just going down to your lower back. So even we say there's benefits to maybe taking the pressure off the disc, but the alignment that you're creating after you get off the inversion just continues to put pressure on that disc, and we don't get anywhere. So it's a tough one. What were some of the physical therapy things that you remember? Was stretches wise? Were they giving you stretches or pulling your knees to your chest, or was it?
A couple stretches. They said I had piriformis syndrome.
Piriformis tight.
So piriformis stretches. Some manual therapy that they did. And a lot of them were in the swimming pool, so aquatic therapy.
Okay.
And with like ankle weights, and then you would hang in the deep end
Gotcha.
for 20 minutes, which that part felt good.
Trying to traction, yeah, the pool, yeah.
And then some exercises in the shallow end, which felt great, but when you get out of the pool, gravity kind of reminds you
Right.
of reality.
I was watching a commercial. It was like, I don't know, some social media, and it was talking about like a tight piriformis, and they had some sort of massager, and they had 2 doctors talking about the massager on the piriformis, and then they said, for whatever reason, the piriformis is tight. And I was like, you can't say that. You have to give an explanation. And perhaps I should stop like being clear to my patients. Just like, well, for whatever reason, your back's for whatever reason, there's no curve in your spine. Like, what's the reason? Like, maybe because I sit too much and I haven't been taught to bend back. Oh, no, for whatever reason. And I'm like, you have to justify the reason. You can't just say for whatever reason the piriformis is tight, because then you completely don't understand. If you don't understand the cause, and you're just looking at the effect and you're treating the effects, you'll never get to the cause, and then therefore it'll keep on happening. When you're pinching a nerve in your lower back, the piriformis is controlled by that nerve. So you're getting a false signal to the piriformis, and the piriformis contracts because there's nerve pressure. So trying to stretch the piriformis, and I get what they're trying to do. They're trying to traction you, it just doesn't lead to a positive place in the long term, because the pressure just resumes right when you get back out, get into the car as you leave the place. All the weight continues to go down to L5. The piriformis just gets tight again, and so perhaps it felt good while we're in the pool or while it's tractioning, but again, I don't plan on living there. The only way I can see setting somebody up for success in the long term is restoring the original alignment. You need that arch back in your spine, and everything I do on this table is to make the spine sort of like clay, soft again, so that we can do the stretches. When I was a kid, we had these things called fulcrums. They were little triangles, and what happened was over a period of months they would lose their rigidity, and so after about 2-3 months you'd have to throw it away and buy another one. And then rollers, little 6-inch foam rollers sort of came out, and they were definitely more rigid, but their pressure was too broad, and so that's what finally got us to like the Denneroll, which is a more focused pressure and allows you to stretch that arch back into your lower back, get that 45-50 degree lordotic arch back. And that's really the only way to to relieve sciatica is by removing the burden. You know, there's two things going on. The joint in the lower back is overworked, so you get joint referral pain. And then if it goes down past the glute, that was the nerve pressure. So you have sort of both things. The joint in the lower back refers pain to that glute area, and then the nerve can go all the way down to the foot. Yep. It's just time. It's like this combing in here, getting all the soreness out of here. There we go. Good. Yeah, it's just becoming pink, which is good. It means that there's not a lot of lactic acid in here. You've really done a good job of stretching this area, getting it moving. There we go. Yeah, it does come out, but it just is a lot. You gotta go pretty deep to get it right there.
Is the gua sha more effective after doing your elbow work?
I think of the elbow like a jackhammer. You know, you kind of break the resistance into little pieces, and then I think of this as like a broom. You know, so after you break the wall into little bricks and pieces, now the broom becomes effective. You know, the broom can't really break down the wall, so they work together to speed up this process of breaking down the glue, the adhesions, the joint restrictions. You know, the joint looks like a handshake. So the two surfaces, you know, neutral's here in the middle. When you bend forward, they separate. When you bend back, they close. And so I always imagine that there's some sort of plaque or crystal on here, and it gets caught. And so there's like a sandpaper or a grit where it's not sliding. And so the more you work the joint and make the joint surfaces like silk, there's an effortlessness that needs to be in there. There can't be any glue in there, whereby when you get in and out of your car, when you play a flute, or when you're moving, this area is essentially sidelined, and all the mechanical utilization happens at L5, which then continues to inflame L5, aggravating L5, giving you the leg symptoms. And my other analogy is like a tooth. You know, the images they took last September that showed the disc injuries, to me that's as close to an analogy to a cavity in a tooth. You know, it's a permanent change in the, you know, composition of the disc, and like a tooth, you know, the tooth is now permanently changed. And so how can you help me, Dr. Ed? We're going to learn how to not chew on that tooth anymore. I believe that's the primary thing that I do. You know, everybody wants, and perhaps one day we'll have stem cells, you know, and they can go in there and actually make the tooth the way it was when it was 18, you know, actually turn back time. But as far as I know right now, year 2020, we're stuck with learning how to mechanically use other parts of the back and not constantly trying to manipulate and reposition the injured areas. Your lower back is injured. It cannot be helped by further manipulation. It needs to be, you know, like I said, the back brace to lock it down, icing it to de-inflame it. When you sit, you have something behind your back here. You know, when you go out to dinner, you bring your Denneroll and you place it here. And so you have just almost like a constant reminder. And I had a patient the other day, and she was like, I feel like I have to be constantly aware of my spine. And I said, that's not necessarily a bad thing. I know when you're 18, you don't have to be constantly aware of your spine. We take it for granted, and we're invincible. And then as we age, we're like, I'm not invincible as I thought I was.
And then I want to, maybe you might have said it. Did your sciatica start prior to all the other stuff, or
After.
After, okay.
Yeah, I started noticing it only when I sat last fall, but it wasn't extreme. It was just more like a mild irritation, and then it kind of progressively got worse to where if I was walking, we used to live in Virginia, so we used to go hiking all the time, kayaking, walking 10 miles a couple times a week like was normal for us.
Mm-hmm.
And then it got to where just taking a walk started irritating my leg.
And the inversion stuff was done after that, right? The inversion was done after it started getting worse, or
During and a little bit before.
so it's plausible that the constantly tractioning it actually
Yeah.
aggravated it in the first place.
Mhm.
Constantly manipulating the lower back. So you're saying before. So why did they start doing that? Why was what was their? If it just because the piriformis was tight?
I guess. I think
Mhm.
they were just focusing on the disc.
Because they saw the disc injury on the MRI,
Yeah.
and you weren't in that too much of symptoms.
Right. It hurt, but it wasn't like I couldn't function in society.
Right.
It was just painful.
Gotcha.
But after the hospital in January and February, once I went home and started trying to go for walks to exercise my lung,
Mhm.
then I realized I was in excruciating pain putting any weight on my left leg.
It was almost like during her lung trauma, all the focus was on the pain from the lung, and it kind of
Mhm.
masked everything else that was going on.
Mm.
And then
Yeah.
the lung started to get better, and then her symptoms from the lower back and
I also quit
And the leg.
taking the pain medication pretty early after coming home
Mhm.
because I don't want to be on a
Mm.
million medications.
Mm.
And in the hospital, I was on a lot.
Mhm.
some type of opioids or something.
That's what they give you in the hospital
Mm.
when you
Mm.
have a chest tube.
Mm.
But yeah, after coming home, it was kind of like this switch
Mhm.
went off, and it was very,
Mhm.
very life changing. I would say my quality of life is completely different right now.
Mm. Just try to clean this channel. Yeah, just keeping this channel as clean as we can. The sciatic nerve has to travel through this tissue, and so, part of the piece of the puzzle I believe that we miss focusing solely on the MRI is the soft tissue component. The medical world and chiropractic world, and I think most doctors in general, we justify a picture with pain. We only take a picture of an area because it hurts.
Mm-hmm.
So pain, picture. The issue with that is that anything we see on the picture, we blame as the reason for the pain.
Mm-hmm.
So patient has pain, take a picture, disc injury, that must be the reason why they're in pain. The issue with this is that I've taken pictures of people that have no pain, and the question would be, why would you do that? Why? Because I'm looking at the alignment. I'm looking at it from, like a dentist takes pictures of people. They don't take pictures of only teeth that hurt. They take pictures of teeth that don't hurt to see how they're aging. You're 30, I expect to see 30-year-old vertebrae, 30-year-old discs. And if I see a 50-year-old or a 60-year-old, I'm going to start wanting to do treatment now to prevent that from further aging at a quick pace. And so, to me, that component of pain is being missed. That, people have disc injuries with no pain. That I've had people with terrible looking x-rays and no pain. And so you can't just say, there's your problem, let's fix that, let's fix the image, and the patient will be happy. That goes into what I call the soft tissue part, which is the bruising, the lactic acid that surrounds the nerve that really can't be measured. So I call it the immeasurables, the parts of why the nerve is aggravated that can't be quantified on a blood test, it can't be quantified on an MRI. And I think it's frustrating as a practitioner that we can't quantify it. There's nothing that I can, I have a patient that's going through chemo and they have a cancer number. The number was 160 and now it's 40. You can sort of see this progression as her cancer's going away through the chemo. And you can go, okay, my numbers are getting better. But there's no number I can give you, like, other than maybe the arch in your spine, increasing as you Denneroll. And how do we know the arch is getting in my spine? Well, if the Denneroll is getting easier. If your spine is desiring to be curved and you place it in a mold and it's easy, right, then you know that the spine's arched. If it's agony to put yourself on the Denneroll, you know that the disparity between where you want to be and where the Denneroll is asking you to be is too large. And so mastering, that's what I call mastering that Denneroll. And everything I do on this table is to try to help equip you, help get the soreness out of your spine so that we can spend as much time on that as possible. Ed, you were way nicer to Angela than you were to me. Didn't do the mini thumper on my back. Mm-hmm. It's because I'm scared of Angela. Uh-huh. Push here, just some gentle pushes here. Just little breaths. I got you. There you go. There we go. There we go. There we go. There you go. I got you. Uh-huh. Mm-hmm. Good, 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 good. Okay. Breathe in deep for me. Exhale. There we go. Other side for me, okay?
Yeah.
Okay, okay. Good. Breathe in and exhale for me. You okay? All right, very good.